All right, welcome back, everybody. I'm going to jazz up our lectures a little bit, make it fun for you and me. Today we'll be diving into musculoskeletal diseases and disorders, and then midway we're going to change direction and cover the nervous system diseases and disorders. If we were in class, this would be a very long day, but since I'm recording or you have decided to either skip onto the video or go through the PowerPoint manually, you can take this lecture and many of the following for the rest of this year at your own pace. Do not slip though, because the amount of information covered does not subside, so stay vigilant in your studies. So let's get started. All right, symptoms of musculoskeletal diseases and disorders include, but are not limited to, pain, tenderness, swelling, malaise, weakness, fatigue, fever, obvious bone deformation, including spontaneous fractures, inflammation, stiffness, weight loss, and height digression. Yes, that's right, you get shorter. Clearly, the spine is involved in this category, so the slide is a nice visual of some deformity conditions. Kyphosis is what we call the smartphone spine, so sit up straight, keep your eyes up. Typically, a curvature in this format results with old age. However, due to smart devices, we are seeing this in younger generations. Lordosis is when there is an abnormal inward curvature of the lumbar spine, also called the sway back. Kyphosis is the abnormal outward curvature of the upper thoracic spine, often seen as the humpback, and then there's scoliosis, and this is when the spine curves sideways left or right. Herniated invertebral disc. This is where the nucleus pulp leaks through the disc wall into the spinal canal, pressing on the spinal nerves. It's very painful. It is often referred to as a slip disc or ruptured disc, and the more common vertebra this occurs to is the fourth and fifth lumbar, or fifth lumbar and first sacral vertebrae. Take a look at the image on the spinal anatomy here at the right. It starts with the cervical on top, and then we have our thoracic region, which is the spine area that covers our lungs. Lumbar is for the lower back, so think L for lumbar, and then you have sacral and coxal, aka your tailbone. So slip discs tend to occur in your lower back. It's more common in men. People may be prone to this condition. However, some sufferers, it is preventable if proper lifting techniques can be used. So you want to lift with your legs, not with your back, especially when it comes to heavy loads. Here's a cross-section of what I was talking about with a herniated disc. This is what it would look like. If you can see, the purple nucleus pulp here has bulged out of place and is now pressing up against the spinal nerve. Etiology of a herniated disc can be caused by spinal trauma from a fall, like I mentioned before, straining from heavy lifting. Or in some cases, you can have an invertebral joint degeneration that weakens the invertebral structure. Clearly, severe back pain is associated with this disorder, and it is worsened by movement. Paresthesia is the term used for describing the sensation of numbness, prickling, or tingling, like ants crawling on your skin. Pain in the sciatic nerve is felt too, and this is referred to as sciatica. There's that tingly ant feeling. To diagnose a herniated disc, scans are quite important. You'll see scans are very common in diagnosis with anything musculoskeletal, so you'll see CT scans and MRIs pop up on these slides. Sciatic pain can be felt with straight leg raising. Myelography is another form of scan used to map the spinal nerves via the injection of a contrast. Before a herniated disc is concluded, other back pain causes need to be ruled out, as treatment tends to be surgical. All right, osteoporosis is a metabolic bone disease affecting 10 million Americans. Bones become brittle, porous, and fracture easily due to the decreased calcium and phosphate in the bones. Typically, this is seen in women over the age of 50. This can be attributed to the decrease in production of estrogen in later age. Estrogen stimulates osteoblasts, so B for blast, for build up. They build up bone density while also keeping up the osteoclasts. These cells tend to break down bone. Without estrogen, the breakdown overcomes new generation, and bones, especially the small bones, are very prone and high risk for breakage. Osteoporosis etiology. It is hereditary. It could be due to long-term steroid therapy, alcoholism, smoking, lactose intolerance, hyperthyroidism contributed to the cause as well. Diet high in protein or fat, and lifetime intake of calcium too can affect this. Signs and symptoms of osteoporosis would be a bone fracture or one of pain, especially in the lower back and hips. It is diagnosed by X-ray or DEXA, D-E-X-A, that's a dual energy X-ray absorption. It measures the bone mineral density. Blood test is a measure level for phosphorus, alkaline phosphatase, total protein, albumin, and creatinine. Excretion of calcium, phosphate, creatinine, and let's see here, hydroxyproline, that can be monitored through urinalysis as well. Treatment. Treatment is dependent upon the cause. The goal, however, would be to slow the loss of mineral calcium along with preventing fractures and control pain. There are supplements that could help, like calcium, phosphate, and multivitamins, biophosphate drug therapy, and physical therapy as well. Pop quiz. The DEXA is a scan for what? The answer is mineral bone density. Usually these pop quizzes are covering the slide before if you haven't caught on yet. Okay, so this slide is a visual of several categories of fractures. The fractures relate to our previous illness there that we were talking about with osteoporosis, and it will also relate to our next disease, osteomyelitis. A fracture is a break or crack in a bone. There can be closed, simple, open compound, a green stick fracture, that's where the bone is partially bent or split. Let's see, your compound impacted, those are super painful. And then there's the incomplete partial fracture where the fraction line doesn't actually cross the entire circumference of the bone. Moving on to osteomyelitis. I have itis in bold and underlined because this is another medical terminology clue. Itis is used to describe diseases or inflammation. So with osteo, which is a suffix for bone, osteomyelitis is a chronic or acute infection of the bone forming tissue, most commonly caused by trauma resulting in a hematoma, which is a bruise, that formation, and an acute bacterial infection such as Staphylococcus aureus. Virus and fungi circulating somewhere in the body may also cause this condition. The infectious microorganism that's circulating may reach the bone marrow through the blood and or spreading from infected adjacent tissue in a similar circulatory manner. Signs and symptoms are specific and depend on which bones are affected and the virulence or strength of that infective agent. An infection of a finger bone is much different than an infection of a leg bone, just by size and location alone. To diagnose, there is a physical exam, blood cultures, aspiration and culture of any fluid from infected sites to try and isolate and identify that organism of concern. Bone biopsies can be done on the same premises. So for scans, we have X-ray, bone scans, MRIs. They can be used to determine the extent of infection and possibly narrow down a site. This is helpful, I'm sure, in the hand and feet when there's so many small bones that could potentially be involved. All right, let's move on to Paget disease or osteitis deformans. It is a chronic metabolic skeletal disease with multiple phases. So the first phase, the bone is rapidly reabsorbed and replaced with bone that is coarse and irregular consistency, and it's enlarged. But even though it's larger, it's more porous and weak. Like when a dry sponge is wetted, it grows, but it loses that rigidity. In the later phases of Paget's disease, the replacement of normal bone marrow with highly fibrous tissue. So please use this link here on this slide to learn and see a patient with this disease and how he came to the diagnosis. So put me on pause and watch the video link. All right, so etiology of this disease is unknown yet. One theory is an early viral infection that can cause a dormant skeletal infection to erupt years later. New research has found genes that may also be linked to this disorder, but no definitive cause has been settled upon yet. Signs and symptoms. In the early stage of Paget disease are asymptomatic, meaning no symptoms. Even bone marrow biopsies could come back normal. The nature of the symptoms that do appear depend on the extent of the disease and what bones are affected. It is a diagnosis with bone like scintigrams, x-rays, repeated bone marrow biopsies to track changes. Blood tests yield high levels of alkaline phosphatase in the blood because that level will be elevated due to rapid rate of bone turnover. In the urine, a urinalysis would show high levels of hydroxyproline, which is an amino acid found in collagen and excreted in the urine after bone is broken down. All right, moving on to a new disease, osteoarthritis. This is a chronic inflammatory degeneration of joint cartilage and bone. It is the most common form of arthritis and occurs equally in men and women up to the age of 55. After that, women take the lead, most likely linked to the changes again in estrogen production. An exact etiology is unknown, though autoimmunity, genetic links, metabolic and mechanical factors are possible. As is aging and obesity, that can make a patient more prone to this disorder. Let's see, signs and symptoms. Signs and symptoms would be an insidious subtle onset with a deep aching joint pain. It comes with stiffness and aching during weather changes due to atmospheric pressure changes. The crepitation, that's the cracking sound that joints make, like cracking or grating bones, like that. Luckily, there is minimal deformity with this disorder. It is diagnosed with a history being taken and a physical exam, and the trifecta of scans, X-ray, bone, and MRI. Treatment starts with a goal to minimize pain, inflammation, disability, all the while maintaining joint function. So we have our NSAIDs, like ibuprofen or Tylenol, can be taken OTC or over-the-counter strength. Let's see here, or if needed, a prescription level from the physician. Physical therapy aids in maintaining joint movement. Injections of artificial joint fluids can help cushion movement and prevent pain too. Sometimes orthopedic surgery is needed. RA, rheumatoid arthritis. Rheumatoid arthritis is quite different. It is a chronic system inflammatory disease of synovial membranes of multiple joints. The synovial membranes is what surrounds the fluid of most joints in the body. So RA destroys that cartilage and it can erode the bones. There is deformity with this disease and sometimes immobility. Cause is unknown, though infections and endocrine factors can be considered. Some people are genetically predisposed to RA, and it is a known autoimmune disease. RA is another slow developer. It starts with malaise, fatigue, fever, weight loss, joint pain, stiffness, and then swelling, especially in the interpharyngeal joints, and that's joints of the hand. This swelling of the joints can appear red and hot to touch. Those in the hand and fingers could feel as if you broke one. This image here is an example of what RA can do to cause deformities in a hand. RA is diagnosed with a positive RF factor test. It's a rheumatoid factor blood test. Serum protein can be sent through electrophoresis, and blood can also be processed with an ESR. ESR is an erythrocyte sedimentation rate, and a CBC, which would be a complete blood count. Synovial fluid would also be analyzed and can be analyzed to do, but it's not easy to attain synovial fluid as well as blood. So it's not necessarily one of the first tests that are assigned. And then you also have scans like X-rays, CTs, and MRIs. RA is tough to treat. The goal is to reduce inflammation, which would then in turn reduce joint pain and deformity. Preserving the joint function is key. NSAIDs or DMARDs, and so that's a disease-modifying anti-rheumatic drug, like hydrochloroquine being one of the most sought-after drug forms of DMARDs, but because it's in short supply due to an unprecedented experimental use in the treatment or preventing of COVID-19, many patients with autoimmune disease that suffer primarily of RA or have RA as a side effect had to go into pain due to national shortages, and that's quite unfortunately. But luckily, the link to COVID-19 was disproved and supplies were once again restored. Biological injectables and surgical repair could also be used if necessary. Gout or gouty arthritis. This is a chronic disorder of uric acid metabolism in joints. Uric acid crystals appear in the synovial fluid from urate compound deposits. It tends to affect men more than women. Metabolic gout is inherited. There's renal gout too, and that's caused by renal dysfunctions, which affects the kidneys. Signs would be a sudden, excruciating joint pain, usually in the big toes, feet, ankle, and knees. It's been around for a long time. I think it's been said Christopher Columbus was afflicted with gout. Since uric acid crystals are floating in synovial fluid, the presence of these crystals is a great tool for diagnosis. When they are there, it's called a tophy in the joints. So if you get it, tophy, since it tends to affect the toes, just a way to help you remember maybe. Other diagnostic tests include a UA, a urinalysis, that will almost always have high levels of uric acid in the urine. This is known as hyper meaning a lot, uricemia. The ESR, which we talked about earlier, is that SED rate. That test is a tell-all to gout, and as is the white blood cell differential. I do want to make note here that symptoms of gout can present even if blood uric acid levels are low, so an X-ray is a good way when looking for skeletal involvement. Okay, treatment. Gout is treated with rest, immobilization of affected parts, and applications of heat and cold. If you notice, gout affects mostly the lower extremities, so getting off of them and elevating them could help reduce discomfort. Analgesics, NSAIDs, corticosteroids, I don't think I'm going to pronounce that right. Colchicines, sorry guys, can reduce pain associated with gout. So would a low purine diet, which purines would reduce the uric acid present. So drinking a good amount of fluid also, specifically water, that would help keep levels of pain more manageable because of the dilution. Pop quiz. Gout is characterized by what in the synovial fluid? Answer? The uric acid crystals. And if you were wondering what they would look like, here's an image of them fluorescing. The crystals are the spindly blue fragments, and here in the image, and in the background, the purple paw print looking things, those are actually white blood cells. Bursitis and tendinitis. Bursitis is inflammation of the bursa, commonly found in the shoulder, arm, elbow, or knee. Tendinitis is inflammation of the tendons, commonly found in the shoulder, rotator cuff, hip, Achilles tendon, or in your hamstrings. Etiology for bursitis is typically due to frictional forces, trauma, systemic diseases, and/or infection. Tendinitis results from overuse. You can have it from RA, also postural misalignment or hypermobility. It's really common in athletes. That's why I have the pictures here of golf and tennis players. Signs and symptoms of bursitis and tendinitis. They both include tenderness and pain upon movement of affected body parts. There's swelling and edema, which would be fluid on site or fluid retention. Pain may interfere with sleep as well. So these disorders are diagnosed by a patient clinical picture and history being taken. Synovial fluid aspiration can be evaluated. CT scan, MRI, X-ray. This is a disorder that other conditions need to be ruled out before a definitive diagnosis is made. You'll see that a lot. All right, with bursitis and tendinitis, they are treated with applications of cold and heat. Also immobilization of the affected area, analgesics, NSAIDs, local steroid injections, PT, which would be physical therapy, hydrotherapy would be great for lower impact, all of which is just to help maintain range of motion. New disease, let's talk about carpal tunnel syndrome. I'm sure we've all had a parent or aunt or uncle who have all had to deal with this. It's quite common with when computers first came out, especially with like ergonomics not really being used. This nerve, let's see here, carpal tunnel syndrome is where the median nerve in the wrist has become compressed. And so the median nerve is on the underside here, you can see in the image. I lost my spot. Let's see. Oh, median nerve in the wrist compressed. Okay, this nerve is in the carpal tunnel. It's seen in individuals performing repetitive motion like typing. The overuse and incorrect use of hands and fingers tend to be the main cause or main etiology. Edema can increase the compression of the median nerve. In this image, if you have your thumb pointing upward and palm out, the nerve runs straight under your thumb area. Not to be confused with the second image, which is the radial one that's on top. Because they are under your wrist, that nerve tends to get pinched and starts causing damage when you're in that continuous typing motion. Signs and symptoms would start with pain, burning, numbness, or weakness in one or both hands. There could be an inability to make a fist or grip along with pain that may interfere with sleep. It is diagnosed with patient history, decreased sensation with pinprick stimulation. There's also positive tingle signs where there is a tingling all over the nerve during but only when it's like with tapping. So if someone like winds up, what is that? Like drumming on the nerve. And then you can also do an EMG, which is an electromyogram. Okay, pop quiz. Carpal tunnel is caused by compression of which nerve? Median, ulnar, radial, or carpal? Answer? Median nerve. Just think median for middle, and that might help you remember it. All right, SLE, systemic lupus erythematosus. This is a chronic inflammation of connective tissue disorder damaging cells and tissues in the body. It affects women 8 times more than men, and it is an autoimmune disease. Sorry, just make my ears are straight. It is an autoimmune disease. The response, though, is unknown. There can be a genetic link to it, as well as hormonal and environmental factors that should be considered. SLE signs and symptoms start off rather vague with weight loss, fatigue, and fever. But then you get this butterfly rash on the face and neck that's quite telling of SLE. In this systemic lupus, there is the medical clue, terminology clue with eryth meaning red. The link there is with the butterfly rash being red. SLE also comes with skin photosensitivity, joint and muscle pain, nausea, vomiting, diarrhea, and then something called Raynaud's phenomenon. You'll see that a lot with autoimmune diseases. SLE is diagnosed with an anti-DNA test image here. A CBC with differential is performed, as well as a SED rate and serum electrophoresis. SLE is treated depending on the organs that seem to be affected. So corticosteroids do seem to be in the mix, and as the photosensitivity, you'd be treating the symptom of protective clothing and sunscreen that would be used. The images here are that anti-DNA test and what the person's antibodies fluoresce. The patterns are indicative of certain autoimmune diseases. Moving on to the last musculoskeletal disorder. It's harder than it looks, guys. Moving on to the last musculoskeletal disorder, we are going to cover fibromyalgia. This is a chronic condition characterized by pain in the muscles, ligaments, tendons, muscle tenderness, and constant fatigue. Women are 80% more likely to suffer from this, more so than men. Etiology is unknown, but genetics have been a factor before. It's likely that there may be an increase in pain signals to the brain that attribute to this condition. Fibromyalgia starts with pain as a dull muscle ache. Then it progresses to tender joints, and exhaustion due to lack of restful sleep. A physical examination showing a widespread pain lasting for 3 or more months will help with diagnosis. They'll do CBCs and ESR, thyroid functions. Those are, again, are tests that are all done to rule out other conditions. And then fibromyalgia tends to be one of those last resort diagnoses. It is treated with a goal to reduce pain and improve sleep. So we have analgesics, antidepressants, anti-seizures. These meds have been used in the past, but now there are target-specific treatments like the drug milnacipran, or you'll see those commercials for it, I'm sure, on television. Okay, last slide of our musculoskeletal disease, and it's a pop quiz. Fibromyalgia begins with what? Is it sharp pain, dull aches, widespread pain, or muscle weakness? And the answer? Dull muscle aches. Rather vague. Okay, I want you guys to take a break if you need, because we are about to start the nervous system disease and disorder, and it's going to be another 40 plus slides, so take a break. Okay, nervous system diseases and disorders. Let me find my spot. Maybe you guys can, there we go. All right. Where are we at? Welcome back. Or let's continue if you didn't pause. We're going to go over nervous system diseases and disorders. Common signs and symptoms of nervous system disease and disorders include headaches, weakness, nausea and vomiting, motor function disturbances, stiff neck or back, rigid muscles, seizure, convulsions, paralysis, sensory disturbances, especially in your vision or speech, drowsiness, stupors, coma, mood swings, fever, and pain. It's a long list. Let's just start simple though with a headache. This is where diffuse pain occurs in any portion of the head. Primarily, headaches are linked to tension, migraine, and clusters. Secondary headaches are underlying structural issues along with cranial neuralgia, facial pain, and other types of headaches. More severe of the headaches are known as the migraine headaches. They are recurrent, intense throbbing. They can cause nausea and vomiting. They affect women twice as much as men. Causes do vary. There can be vasodilation of cerebrocrinial arterioles, hereditary indications, and environmentally you can be exposed to certain foods, sunlight, hormones, smells, or changes in weathers can be trigger. Signs and symptoms of a migraine tend to come with photophobia, tinnitus, craving for sweets, and an unusual thirst or alteration in mood and mental clarity, and then usually headaches follow. Migraines are diagnosed depending on a patient history. Some tests can lead towards a diagnosis by the use of an EEG, which is an electroencephalogram, a CT, and an MRI. All right, let's move on to a different disorder. We're going to talk about cerebral concussion. This is the most common head or traumatic brain injury out there. There is a temporary loss of consciousness lasting a few seconds to minutes. Concussions may or may not be immediately apparent. They are usually caused by a blunt force impact to the head. The impact can cause the brain to strike and rebound from the inside of the skull. This trauma winds up disrupting normal brain activity. What I want you to do is take the time, follow this link, so put me on pause and find the link and follow it, and it'll give you a visual description of what happens to the brain during a concussion. Signs and symptoms of concussion could include temporary loss of consciousness, usually that means less than 1 hour, dizziness, depressed pulse rate, flaccid muscle tone. They are diagnosed with a neurological assessment. Cranial CT scan would show no brain tissue damage, and an MRI would help as well. Pop quiz. A cerebral concussion could result in what? Coma, loss of concussion, death, or loss of concussion longer than an hour? The answer? It's a temporary loss of concussion. Okay, a bit more serious than a concussion would be a traumatic brain injury, TBI. This occurs when the brain collides with the inside of the skull to such an extent that it causes bleeding, bruising, and tearing of nerve fibers. Causes would be a sudden violent blow to the head. You can see this in sports injuries, vehicular crashes, assaults, military conflicts, and other catastrophic events. Mild traumatic brain injury is still very serious. It does result in a brief loss of consciousness, amnesia, headache, confusion. You'll have ringing in the ears, blurred vision, and mood changes. More severe injuries can yield persistent headaches, nausea, and vomiting. There'll also be slurred speech, convulsions, numbness of the extremities, agitation, inability to be woken up either on your own or with slight stimulation. A TBI is diagnosed using CT scans and MRIs. The Glasgow Coma Scale is used to test severity of the injury as well as the use of brain pressure probe. They can be treated with bed rest and analgesic if the trauma is mild, but on a more severe end, TBI would be treated with diuretics to help keep excess fluid down, and the goal would be to prevent any buildup of excess pressure. Anti-seizure and coma-inducing medicines would be used, surgery to remove any clots, fractures, and repaired, and or the other side, they actually might remove part of the skull to provide a space for the brain if swelling has occurred. A cerebral contusion. This is a bit more serious than a concussion. It's a very serious TBI that bruises the brain tissue. The bruising brings about several broken blood vessels. It's the deadliest of all TBIs. The etiology would be a very severe blow to the head or impact of head against a surface, or even the hemispheres of the brain wind up twisting or torsioning and sliding along inner surfaces of the skull. Signs and symptoms of a brain contusion would vary according to severity. There would be a loss of consciousness or even coma. Hemiparesis, that is hemi meaning half and paresis meaning paralysis, would mean that the patient would become paralyzed on one side of the body or the other. Severe headache would be an understatement, and lethargy along with potential hostility and combativeness would be recognized in the patient. It would be diagnosed with neurological assessment. Cranial CT and MRI to treat a cerebral contusion would require hospitalization. The patient would need to be monitored. Medical intervention as necessary, and surgery would be needed to control any bleeding. All right, not to be confused with TBI. This is abusive head trauma, aka shaken baby syndrome. Sorry, my dinosaur hat's itching. Let's see here. It isn't necessarily a one-time traumatic hit, rather it can be an ongoing event and seen in a child. It is due to vigorous shaking of any infant or child that results in brain subdural hematoma. It causes brain damage, mental disability, seizures, and death. The violent shaking brings about this subdural hematoma and hemorrhage, and the brain trauma and nerve cell damage, loss of oxygen, retinal hemorrhage, along with skull fractures. Unfortunately, abusive head trauma can go unnoticed or unreported for some time. Some signs and symptoms include difficult feeding, vomiting, listlessness, lethargy, and seizures. This disorder is a medical emergency where hospitalization is needed for infant safety. In cases like this, usually social services and child protective agencies are contacted. All right, let's move on to the spinal cord. Injuries of this nature can be further described as to how the body has become paralyzed. So we have hemiplegia, which is the paralysis, like I mentioned earlier, from one side or the other. We have paraplegia. This is paralysis of the trunk usually, but also the lower extremities, so your legs. Quadriplegia is where all four extremities and usually the trunk is involved. Spinal cord injuries tend to be seen more often in men, especially in the age group of 16 to 30-year-olds. Some injuries are preventable, like parkour, cliff diving, or extreme sports. Etiology could start with fracture or dislocation of vertebral column that causes the spinal cord to become injured. Location is key. Along with the severity to determine the type of paralysis that may occur. Signs and symptoms would be falling blood pressure and temperature. You'd have bradycardia, which is it's abnormally low heart rate, difficulties, and then a notable level of paralysis in any limbs. To diagnose a spinal injury, a neurological assessment is needed, spinal X-ray, CT, and MRI scans as well. Pop quiz. Paralysis in the trunk and lower extremities is, so if it's just your two extremities, the lower ones, what is it called? Quadriplegic, hemiplegic, paraplegic, or dislocation? Answer? Paraplegic. Remember, para means pair, or pair means two. This would denote it affects both legs along with the trunk at times. Okay, meningitis. Let's talk about something a bit more notable and infectious, and that would be meningitis. This is a very serious inflammation of the brain meninges. The meninges is a thin layer that winds up surrounding the brain. Meningitis can be acute, can be chronic, viral, or bacterial. Acute bacterial meningitis falls into a medical emergency category, and it needs to be addressed as soon as possible. Etiology, I guess it would depend on the offending agent, but it's how it enters the brain or spinal cord via the blood, or it results from an ear or sinus infection, and that's just because of the close proximity to the brain. Majority of cases are viral, though bacterial causes can include Neisseria meningitidis. I mean, it's in the name, meningitis, and then you also can have, it can be caused by Streptococcus pneumoniae. Signs and symptoms include nuchal rigidity. This is just a fancy way of saying stiff neck. However, it is rather severe, to the point where the patient cannot flex the neck forward and have the chin touch the chest. How many of you just did that just now? This is also a sudden severe headache arises, fever. Sometimes you'll have seizures along with stupor or coma that may occur. To diagnose meningitis, we must get a look at what is flowing around in the spinal fluid. What we need to identify that infectious agents. This means that a lumbar puncture to analyze CFS pressure to drain and look at that agent. It is also used to look for increased protein, elevated white blood cells. What else do we look at? Decreased glucose levels may be seen in fungal or bacterial meningitis because sugar, like glucose, that's the food source for microorganisms. So if there's a decreased level of that glucose, there might be something actually swimming around in that fluid that is eating up that sugar. Besides analyzing CFF, blood and urine cultures are set up to determine secondary infections, and scans usually are on the list as well, the CT and MRI. To treat meningitis, it's all hands on deck. It requires hospitalization and aggressive antibiotic therapy for any bacterial causes. Decreased brain swelling is important to prevent CSF blockage, and an antiviral could be prescribed for any potential viral causes. Another nervous system disease is peripheral neuropathy. This is the degeneration of nerves carrying impulses to and from the brain and spinal cord. It causes a loss of sensation and pain as well as lack of muscle control. It has a rather phantom-like feeling. Other names of this condition can be called multiple neuritis, polyneuritis, and peripheral neuritis. Not much else to be said on this one here. Another big hitter is the stroke. Its medical term is cerebrovascular accident. This is where there is an occlusion or hemorrhage of blood vessels in the brain and causes a sudden impairment of consciousness, ultimately leading to some form of paralysis. There are two main types, ischemic and hemorrhagic. 70 to 80% are ischemic, that are usually caused by a thrombosis or clot or emboli. Hemorrhagic attacks are caused by hypertension, aneurysms, head injuries, and those tend to be a little bit more fatal. They have higher fatality rates. Signs and symptoms of a cerebrovascular accident could be best categorized in the, if you use the FAST figure from your text, page 232. There can be a sudden or gradual onset. It impairs speech or consciousness, hemiparesis, Cheyenne-Stokes respiration, which is a period of apnea meaning not breathing, for about 10 to 60 seconds, but then you're followed by this catch-up moment of quick, increased, deep breathing. There's also poor coordination and confusion. As per usual with nervous system disorders, there is a neurological exam that is needed. This will help aid in the diagnosis, as is a cerebral angiogram, CDA, MRI, and MRA, which is a magnetic resonance angiography. Ultrasounds of the carotid and transcranial Doppler could give the physician an image of blood through the cranial vessels as well, see if there's any clots. To treat something so in-depth would start by designating the patient, making sure that they're put into a medical emergency. If someone is having a stroke, most facilities will call a code stroke so that everybody can get there and try to prevent as much damage as possible. This depends on the severity and cause of the accident. Ultimately, the goal is to minimize any permanent disability, so there's drug therapy, anticoagulant, antiplatelet agents that can be used. There's also a chance for surgery interventions, but more likely physical rehabilitation will be needed as well. Here's another disease to briefly discuss. It's TIA, transient ischemic attack, kind of relates to the stroke. Most commonly it's referred to as ischemia. This is that medical terminology clue. So you see emia, so you know that blood's involved. Ischemia is that temporary and often recurrent episodes of impaired neurological activity resulting from insufficient blood flow to part of the brain. It's like a mini stroke. This is for sure a warning that a larger stroke may be coming though, which we did cover just a few slides ago. Alzheimer's disease. So we're going to get into some like degenerative mental disorders. Alzheimer's disease is a very progressive chronic disorder. It is where the cerebral cortex becomes a tangled mass of non-functioning neurons, microscopic neurotic plaques, acetylcholine is reduced, resulting in progressive memory loss and deterioration of judgment. It is a sad degenerating disease that affects 1 in 8 adults after the age of 65. This is why so much research and time is put into this disease to try and find a cure. Its causes or etiology are precisely unknown. There have been links to hereditary, autoimmune reactions, viral origins were suspected as well. I've read that links to something like sleep, or the lack of, or poor quality has its levity as well. Even if the causes are still open, signs and symptoms are a sure thing. There is increased mental impairment, loss of short-term memory, inability to learn new things. There's changes in your personality, in the patient's personality too. The disease could take 5 to 10 years to really progress. It can get so debilitating that the body loses its ability to remember to eat or breathe correctly, causing secondary ailments in the suffering patient. Diagnosis can be tricky. Sorry. It's a long lecture. Diagnosis can be tricky. Usually it's one of those that you have to rule out other degenerative brain diseases. That has to be done first. Family and patient history along with a physical exam is needed. This could include mental health status, basing the patient's mood off of a depression scale, and then you have cognitive functioning tests, PET scans, cranial CT scans. MRI will help rule out any other conditions as well. Pop quiz. Alzheimer's disease has or is it an acute brain attack, a quick onset of symptoms, non-progressive chronic disorder, or a progressive chronic disorder? The answer, it is a progressive chronic disorder. There is nothing quick about Alzheimer's disease. Okay, another sad degenerative nervous disorder is Parkinson's disease. It is a chronic and crippling progressive muscle rigidity and includes involuntary tremors. It affects men more than women, and usually they're over the age of 50. It affects people in different ways. A famous face of a Parkinson's disease patient here is Michael J. Fox. He's from the Back to the Future franchise. I don't know if I'm dating myself here. He was diagnosed at the age of 29, though. He's done wonders with bringing light to the disease as well as funding for a cure. Etiology is unknown. There have been notable deficiencies in the brain chemical dopamine that is necessary for brain cell functioning, and a lead that might help in early diagnosis. Signs and symptoms of Parkinson's disease would be a slow, insidious movements. Bradykinesia is a term used to describe the abnormally slow movements. The extremities lose their fluid motion and become more rigid. You'll see tremors of someone suffering from this disease, known as pill rolling, or their hands. Many patients become aggravated easily by stress, fatigue, anxiety. Deep depressions have been known to set in. There was somebody else, another famous actor who was with Parkinson's disease, and that was Robin Williams, and he succumbed to depression via suicide. This link here, though, is an old interview of Michael J. Fox. This is him a little later in his degeneration, but I think it was in 2018 when the film was the interview was posted. He's still doing interviews. I'm not sure if he's acting. I know he has a foundation. But what I want you to do is I want you to take the time to watch the video and see how the disease can affect someone. And I want you to notice his speech and body movements. They do have some clips of him in the past versus now, and just see how he's degenerated over the last decade. All right, I hope you guys took the time to watch that video. Diagnosis is something that Michael J. Fox's group is trying to get a jump on. At the moment, diagnosis comes too late, with physical tremors and bradykinesia already being set in. A neurological exam and blood screens, MRI, can conclude this disease. At the moment, treatment systems are the focus. So you have levodopa, which is a dopamine replacement drug that's used to control the dopamine levels in the brain. And then you have anticholinergics, and that is prescribed to control tremors, and a deep brain stimulation surgery could help with functionality. A disease that has to be ruled out when diagnosing Parkinson's disease is multiple sclerosis, MS. This will be our last disease discussed today. Yay! It is another chronic, progressive, and irreversible disease. It destroys lipid protein layer of certain nerve cells that's called the myelin sheath. This sheath protects nerve cells, so without that, the nerves become damaged. It is a suspected autoimmune disease, and you can see in the image here one nerve cell that has intact myelin sheath, and then one that has damaged nerve cell damage, and you can see the nerve pulses below it. Signs and symptoms of MS vary. It depends on the scattered sites of the demyelination in that nervous system. So the symptoms can come with or without warning. There's numerous remission moments. Those can occur. Visual, motor, sensory disturbances, numbness, fatigue, and mood swings are noted in MS sufferers. Multiple sclerosis is difficult to diagnose. A neuroexam is needed. CFS is analyzed. There's usually a CT and MRI performed as well, along with periodic testing during remissions and after spells to kind of handle affected body systems. Observation is essential, and breathing can be affected in late stages. Okay, well, we did it. That was a great deal of information. Which will be on this week's exam. Exam 2 covers chapters 6 through 10. Use this week's objective, or use the weeks 6 to 10 objectives to study. Your exam is due Friday. You'll have it at your Iowa City or main Cedar Rapids campus, like before. Let's see here. As for your discussion post, it covers exam 3 topics, so I would advise you studying for exam 2, take exam 2, then move on, read the new information, and complete your chapter 3 discussion assignments. Reach out if you have any questions, if you want to borrow my hat. But other than that, good luck, and I will see you guys at your next lecture.